Guess who never wants to see a penis again after doing the research for this video? This guy! Hi! Welcome back to SquidThink! New background today. How are we feeling about it? Do we like it? Do we not like it? Let me know in the comments down below. It is early September and people are going back to university. Some people are going to university for the first time. I, personally, have been at university for 2 years. And one thing that I've learned is that everyone is a whore at university. So today we're going to be talking about the worst STDs that you can get. Because sometimes fear-mongering is just really necessary. No, I'm kidding. Most of the STDs that we're talking about today have treatments available. A lot of people get really scared when they find out that they've been diagnosed with an STD and they feel like either it's the end of their life because of the social stigma or because of how horrible the symptoms are. But actually, most STDs are curable and very easily and accessibly treatable. The three we're going to be talking about today, I think, are the worst in terms of three categories. So the grossness of the symptoms, the social stigma that's associated with the illness, and the probability of you contracting it. I don't think YouTube is going to take too kindly to me if I include pictures of the stuff I'm going to be talking about in the video. So you're going to get some examples of my illustration abilities. Spoiler alert, not great. But for those of you who are extra curious and who just really love science just all that much more, I'll leave you links in the description to pictures of the things I will be talking about. You weird, weird people. A lot of STDs are actually pretty well known if you live in a country where you have good sex education, like in the UK where we have the NHS. We're pretty clued up on STDs. So most people know about things like herpes, gonorrhea, chlamydia. There's actually a lot of STDs that many people don't really know about. So like, for example, there's one called molluscum contagiosum, which causes just kind of small raised bumps on the skin. Another one that you may not know about, but actually falls into our first category, which is the grossness of the symptoms. So this is number one on the list, which is lymphogranulonum venereum, or otherwise known as LGV. So I'll be referring to it as LGV in the video from now on because that one's a mouthful. LGV is a chronic lymphatic system infection which is caused by the same bacteria that causes chlamydia. So it's caused by the chlamydia bacteria, but the specific species is Chlamydia trachomatis. If you're watching this and you have delicate ears, I would advise that you plug them up immediately because the symptoms of this illness include, but are not limited to, drainage in the skin through the lymph nodes of the groin, labial swelling, really painful shits, and blood and pus drainage, my hand doesn't go any more than that, and blood and pus drainage from the asshole. Hi, it's me from the future, but only by a little bit because I only just finished filming this. I just had a look through some of the footage and it's become painfully apparent to me that I do not know how to count things on my hands. My tendons are really tight, they don't like doing stuff, but yes, so sorry about that. Back to the video. If you are experiencing any of these symptoms or are concerned that you may have LGV, first of all, why are you watching this video? Go to the fucking doctor. Second of all, the tests for LGV include having a biopsy of the lymph nodes, which is performed by a doctor, having a blood test to see if there is chlamydia bacteria present in your blood, or just doing a regular chlamydia test, so just doing a swab. Luckily, treatment's actually pretty easy. It's just treated with antibiotics the same way that chlamydia is treated. So something like erythromycin would normally be used to treat LGV. You take that over a course of about 3 weeks and you pretty much all good to go. You're cleared up. As long as you take it properly, because antibiotic resistance is a thing. Don't f around with antibiotics. I thought I'd just slide in another one for this category, just an honourable mention real quick, and that is syphilis. Syphilis comes in 4 stages, which is primary, secondary, tertiary, and latent. The primary stage of syphilis is literally just exhibited by the presence of a sore on the affected area. So you may notice on the shaft, I'm going to be saying the word shaft a lot in this video. You may notice on the shaft that there is what you call a chancre sore. So a chancre sore is just a circular kind of looking slightly red, maybe with a yellow rim sore, which is the entry point of the bacteria for syphilis. This will show up after about 3 weeks of the initial infection, but clears up after about 3 to 6 weeks later. The second stage is where things get a little bit more intense. You start noticing that there's a rash appearing on the trunk of your body, and so that's kind of like the stomach area, which then eventually spreads to your entire body. Other symptoms like swollen lymph nodes, hair loss, muscle fatigue, they're also very common in the secondary stage. In the latent stage of syphilis, things calm down a little bit because nothing happens, you have no symptoms. All the symptoms of the primary and secondary stage are just donezo, so the tertiary stage may last for a couple years or till the rest of your life. It just depends on person to person. And finally, the latent stage. The latent stage don't f*** around. The latent stage of syphilis affects about 15 to 30% of people who either have left it completely untreated because they just didn't know that they had it, or by choice for some reason. This is when the disease starts to affect basically every part of your body that you need to stay alive. So this includes your brain, your nervous system, your bones, your blood vessels, your liver, your heart, literally anything important, anything really important to make your body survive, it will fuck up. Luckily, again though, it's really easy to treat. It can be treated in the very early stages. So once you get to the latent stage, it's much more difficult, but during the primary and secondary stages, it's pretty damn easy. So you just get a shot of an antibiotic. For example, penicillin is quite a common one. If you're pregnant and you have syphilis, penicillin is your only option. But you will undergo a adjustment period, so you'll get miniature exposure therapy if you are allergic to penicillin. But if you're not pregnant and you have syphilis and you are allergic to penicillin, there's loads of options, it's fine. A really big risk factor when it comes to the contraction of both LGV and syphilis is being HIV positive, which leads me to my next one. I chose HIV for the next category, which is the social stigma surrounding the disease, because I feel like there's a lot of misconceptions surrounding HIV. HIV is a viral infection which is passed through bodily fluids, so like blood, semen, or even breast milk actually. So usually the methods through which it's passed is either sexual intercourse, either anal or vaginal, or through the sharing of needles. The symptoms of the initial infection will be pretty similar to what you'd get if you had the flu, so like diarrhea, weight loss, muscle fatigue, general fatigue, things of that nature. But the reason that HIV in the past has been so deadly is because the way that it works and the way that it replicates is it destroys your immune system and the cells which work as your immune system. Once a virus enters your body, a hormone called interferon is released. Interferon basically just prevents the virus from replicating and it destroys infected cells in the body. HIV is not equivalent to AIDS. I've heard the terms be used interchangeably a few times. HIV is the virus which is responsible for AIDS. You can have HIV and not have AIDS. HIV works by killing CD4 cells. Now, CD4 is a glycoprotein which is present on the membrane of certain cells which are used in the immune system, like T helper cells. T helper cells are particularly important because they basically activate other cells in the immune system, which is what protects you from catching viruses or catching other pathogens, and it's responsible for your adaptive immunity as well. So your adaptive immunity is basically what stops you reoccurringly getting things. A normal count for CD4 cells, so cells that present the glycoprotein on their cell surface, is about 500 to 1,500 in a healthy individual. But once this count falls below 200, that's when you get diagnosed with AIDS. Viruses like HIV are really difficult to treat because they don't act in the same way, so they don't replicate or live the same way that bacteria do. So it's impossible to use antibiotics as a treatment. Luckily for pretty much everyone, in the last 10 years, HIV medications have come leaps and bounds. New medications available like pre-exposure prophylaxis, or as it's commonly known, PrEP. This drug, PrEP, basically prevents the virus from permanently residing in your body, so you could be exposed to HIV, but there's no way that it would be able to stay in you. If you take it on a daily basis, it's 99% effective at preventing contraction of HIV. This effectiveness drops down to 74% though if you are using drugs and sharing needles. So if it's bloodborne, then it's a little bit less effective, but it's still pretty good. There's a really big misconception though that if you have HIV, you shouldn't be having sex, but this really isn't the case. If you're on the correct medication and you're taking it properly, there is very little risk that you'll pass on the virus. The people who are at the biggest risk of passing on the virus are people who are unaware of their HIV status, so people who don't get tested regularly. Drugs that are available now to help with the symptoms of HIV as well are amazing. There's such a wide range of antiretroviral drugs available now, which are drugs that basically stop the virus in its life cycle so it can't replicate throughout your body anymore. This type of therapy, and amongst others, have enabled people now with HIV to live the same lifespan of someone without the virus. I fucking love medicine, like honestly, man. So if you take all your medicine correctly, really difficult to pass it on. But now we're going to go a little bit in the opposite direction, and we're going to talk about something that's really easy to pass on. I'm talking about the human papillomavirus virus, or HPV for short. This one's on my list because it's so easy to get. And when I say so easy, I mean almost 80% of people who are sexually active will have contracted HPV at some point. Usually people have no idea that they have HPV. The reason the infection is so common is because it can be passed through basically anything. So it can be passed through oral, anal or vaginal sex. Just skin to skin contact is enough for you to get it. There's over 40 types of the human papilloma virus, but only a couple of them are actually going to do any harm. But when I say only a couple are going to do any harm, those ones literally lead to cancer. So yeah, yikes. Luckily, a vaccination for HPV is actually available, but it's recommended that you get it between the ages of 11 and 12. Now, this vaccination point is pretty important because there is no cure for HPV. One of the symptoms of HPV is genital warts. Warts can be treated with an over-the-counter topical treatment of salicylic acid, or you can have more invasive surgical methods which are performed by a doctor, such as laser or cryotherapy, or just surgical intervention where they just cut it off, or a more intensive acid like trichloroacetic acid, but this needs to be applied by a doctor. If you catch a type of HPV that does cause cancer, which I really hope you don't because I hope you got vaccinated, then you would treat this with the usual cancer treatments of, radiotherapy, chemotherapy, etc. To reduce your risk of contracting HPV, although you're probably almost definitely going to get it, is number 1. You can practice safe sex. Because we all know that we can have fun, but it's even more fun when we can have safe fun. You could get vaccinated, which really shouldn't be a controversial point, but I think it is now. Tell me if I'm wrong. I really hope I'm wrong. 3. You could be in a monogamous, long-term, committed relationship to reduce the number of your sexual partners. Number 3 is not my favorite option, but if that's your jam, hell yeah, you crazy kids. You go be in love and stuff. Yeah. Or number 4, don't f*** anyone with warts on their genitals. I really hope number 4 is obvious. Nah, but in all seriousness though, as funny as we may find the concept of STDs and as much as we make fun of them, they are not anything to be embarrassed about. Just go get tested regularly, make sure you're safe, and if you're worried, go speak to a doctor. Anybody who is worth having sex with is worth having this conversation with. You should always be safe with your partners, and you should always make sure you are safe for your partner and that they are being safe for you. Especially if you're in a polyamorous family or in a polyamorous circle, make sure that you are getting tested regularly, because if you're having multiple partners, especially if you're spider webbing out, like if your partner has multiple partners and their partners have multiple partners, make sure you're being safe and make sure you're having fun. But yeah, that's all I have for you today, guys. I really hope you enjoyed this video, as I always do, because I need people's approval. If you enjoyed the video, feel free to hit the like button because it's a free way that you can support the channel. Thanks again for watching, and I will see you guys in the next video. Goodbye. I never know how to end videos, but damn it, I'm trying. Okay, goodbye. I'm leaving now.